Hello, everyone. Today, we will start learning about the visceral nervous system. The visceral nervous system is a component of the nervous system. According to the different distribution sites, it can be divided into the central part and the peripheral part. The peripheral part is mainly distributed in the internal organ, cardiovascular system, smooth muscles, and glands, so it is also known as the visceral nerve. Similar to the somatic nerve, the visceral nerve can be divided into sensory and motor fiber components according to the nature of the fibers. 1. Visceral motor nerve. The visceral motor nerve regulates the movement of the heart and blood vessels and the secretion of glands. It is usually involuntary and not controlled by human will, so it is also called the autonomic nervous system, because it mainly controls and regulates the material metabolism activities common to plants and animals and does not innervate the skeletal muscles unique to animals. It is also known as the vegetative nervous system. Obviously, these two terms refer to the visceral motor nerve and do not include the visceral sensory nerve. According to the morphological, functional, and pharmacological characteristics, the visceral motor nerve is divided into two parts, the sympathetic nerve and the parasympathetic nerve. The following is an introduction to each. 1. Sympathetic nerve. The lower-level central nervous system of the sympathetic nerve is located in the intermediolateral nucleus of the lateral column of the gray matter of the spinal cord segments from T1 to L3. The preganglionic fibers of the sympathetic nerve originate from the cells of this nucleus. The peripheral part of the sympathetic nerve includes the sympathetic trunk, sympathetic ganglia, as well as the branches and sympathetic plexuses arising from the ganglia. According to the different positions of the sympathetic ganglia, they can be further divided into paravertebral ganglia and prevertebral ganglia. 1. Paravertebral ganglia. The paravertebral ganglia, also known as the sympathetic trunk ganglia, are located on both sides of the spine. They are connected by interganglionic branches to form two sympathetic trunks on the left and right sides. The two sympathetic trunks run along both sides of the spine, extending from the base of the skull to the coccyx, and the two trunks merge in front of the coccyx. The entire length of the sympathetic trunk can be divided into cervical, thoracic, lumbar, sacral, and coccygeal parts. There are 19 to 24 sympathetic trunk ganglia on each side, including 3 to 4 in the neck, 10 to 12 in the chest, 4 in the lumbar region, 2 to 3 in the sacral region, and the two sides of the tail merge into a single ganglion impar. The sympathetic trunk ganglia are composed of multi-level neurons with different sizes. Some of the postganglionic fibers of the sympathetic nerve originate from these cells, while the rest originate from the prevertebral ganglia. There are 3 destinations for the postganglionic fibers of the sympathetic nerve. The postganglionic fibers originating from the sympathetic trunk ganglia return to the spinal nerves through the gray communicating branches and are distributed along with the spinal nerves to the blood vessels, sweat glands, and erector pili muscles of the head, neck, trunk, and limbs. They attach to arteries and run in the adventitia of the arteries, forming corresponding nerve plexuses, such as the internal and external carotid plexuses, celiac plexus, and superior mesenteric plexus, and are distributed to the innervated organs along with the arteries. They are directly distributed from the sympathetic ganglia to the innervated organs. 2. Prevertebral ganglia. The prevertebral ganglia are located in front of the spine and include 1 pair of celiac ganglia, 1 pair of aortocarinal ganglia, and 1 superior mesenteric ganglion and 1 inferior mesenteric ganglion each. 2. Distribution of sympathetic nerves. 1. Neck region. The cervical sympathetic trunk is located slightly behind the cervical blood vessels and in front of the transverse processes of the cervical vertebrae. There are generally 3 to 4 sympathetic ganglia on each side, and in some cases, up to 6. They are respectively called the superior, middle, and inferior cervical ganglia. The superior cervical ganglion is the largest, fusiform-shaped, and is located in front of the transverse processes of the first to third cervical vertebrae and behind the internal carotid artery. The middle cervical ganglion is the smallest and may sometimes be absent. In some cases, there can be up to 3, located at the transverse process of the sixth cervical vertebra. The inferior cervical ganglion is located in front of the root of the transverse process of the seventh cervical vertebra and behind the origin of the vertebral artery. It often merges with the first thoracic ganglion to form the cervicothoracic ganglion. The distribution of the postganglionic nerve fibers from the cervical sympathetic trunk ganglia can be summarized as follows. They connect to 8 pairs of cervical nerves through the gray communicating branches and are distributed along with the branches of the cervical nerves to the blood vessels, sweat glands, and erector pili muscles of the head, neck, and upper limb. Adjacent arteries to form the internal carotid plexus, external carotid plexus, subclavian artery plexus, and vertebral artery plexus, etc., and follow the branches of the arteries to the glands, such as the lacrimal gland, salivary gland, glands in the oral and nasal mucosa, thyroid gland, etc., erector pili muscles, blood vessels, and dilator pupillae muscles in the head and neck region. The pharyngeal branches they send out directly enter the pharyngeal wall and, together with the pharyngeal branches of the vagus nerve and glossopharyngeal nerve, form the pharyngeal plexus. The 3 pairs of cervical sympathetic trunk ganglia respectively send out the superior, middle, and inferior cervical cardiac nerves, which descend into the thoracic cavity and join the cardiac plexus. 2. Thoracic region. The thoracic sympathetic trunk is located in front of the costal heads. There are generally 10 to 12 ganglia, with 11 being the most common. The thoracic sympathetic trunk ganglia send out the following branches. They connect to 12 pairs of thoracic nerves through the gray communicating branches and are distributed along with them to the blood vessels, sweat glands, and erector pili muscles of the thoracic and abdominal walls. Many branches are sent out from the upper 5 pairs of thoracic ganglia and participate in the thoracic aortic plexus, esophageal plexus, pulmonary plexus, and cardiac plexus, etc. The greater splanchnic nerve is composed of preganglionic fibers that pass through the 5th or 6th to 9th thoracic sympathetic trunk ganglia. They converge into one trunk while traveling anteroinferiorly, descend obliquely along the front of the vertebral body, pass through the crus of the diaphragm, and mainly terminate at the celiac ganglion. The lesser splanchnic nerve is composed of preganglionic fibers that pass through the 10th to 12th thoracic sympathetic trunk ganglia. It descends through the crus of the diaphragm and mainly terminates at the aortocarinal ganglion. The postganglionic fibers sent out by the celiac ganglion, aortocarinal ganglion, etc., are distributed to the solid organs such as the liver, spleen, and kidney and the digestive tract above the left colic flexure. The least splanchnic nerve does not always exist. It originates from the last thoracic ganglion, travels with the sympathetic trunk through the diaphragm into the abdominal cavity, and joins the renal plexus. 3. Lumbar region. There are approximately 6 pairs of lumbar ganglia in the lumbar region, located between the anterolateral side of the lumbar vertebral body and the medial edge of the psoas major muscle. The branches of the lumbar sympathetic trunk include: the gray communicating branches connect to 5 pairs of lumbar nerves and are distributed along with them. The lumbar splanchnic nerves are composed of preganglionic fibers that pass through the lumbar ganglia. They terminate at the prevertebral ganglia in the abdominal aortic plexus and inferior mesenteric plexus for neuron exchange. The postganglionic fibers are distributed to the digestive tract below the left colic flexure and pelvic organs, and some fibers are distributed to the lower limbs along with the blood vessels. When there is vasospasm in the lower limbs, surgical resection of the lumbar sympathetic trunk can be performed for relief. 4. Pelvic region. The pelvic sympathetic trunk is located in front of the sacrum and of the anterior sacral foramina. There are 2 to 3 pairs of sacral ganglia and a single ganglion impar. The branches of the postganglionic fibers connect to the sacral and coccygeal nerves and are distributed to the blood vessels, sweat glands, and erector pili muscles of the lower limbs and perineum. Some small branches join the pelvic plexus and are distributed to the pelvic organs. In summary, the distribution of the postganglionic fibers of the sympathetic nerve follows certain rules. For example, after the preganglionic fibers from the intermediolateral nucleus of the T1, T5 segments of the spinal cord synapse with neurons, the postganglionic fibers innervate the blood vessels, sweat glands, and erector pili muscles of the head, neck, thoracic organs, and upper limbs. After the preganglionic fibers from the intermediolateral nucleus of the T6, T12 segments of the spinal cord synapse with neurons, The postganglionic fibers innervate the solid abdominal organs such as the liver, spleen, and kidney and the digestive tract above the left colic flexure. After the preganglionic fibers from the intermediolateral nucleus of the upper lumbar segments of the spinal cord synapse with neurons, the postganglionic fibers innervate the digestive tract below the left col flexure, pelvic organs, and the blood vessels, sweat glands, and erector pili muscles of the lower limbs. For details on the segmental fibers of the sympathetic nerve, please refer to the nerve distribution table of visceral organs.